When the COVID-19 pandemic first hit, the whole world was laser-focused on one thing, right? The virus. But underneath that massive public health crisis, a different kind of crisis was quietly taking root. So today, we're going to dive into a really important academic study that actually measured the pandemic's hidden toll on our mental health. We're going to turn all that data into a story that makes sense. Okay, let's get into it.
We all got pretty familiar with the biological risks. You know, the infection numbers, the hospital stats. But what about the psychological fallout? That's the big question we're tackling in this explainer, looking past the virus itself to understand the emotional shockwaves it sent through all of us.
So let's go back in time for a second, to March 2020. The World Health Organization officially declares a global pandemic. And as everyone scrambled to fight the virus, the secondary impact, the hit to our mental well-being, was often, as the study's authors put it, underestimated and neglected. A hidden cost was building up, in silence.
But, how'd you even begin to measure something like that? Well, a team of researchers down at the Federal University of Pelotas in southern Brazil, they decided to try. Right in the middle of 2020, they set out to take a snapshot of the mental health of their own university community, and what they found gives us one of the clearest pictures we have of this hidden crisis.
And this wasn't some small poll. Just look at the scale of their work. They surveyed nearly 3,000 people. We're talking students, professors, and administrative staff, right in the thick of the pandemic's first big wave. They used a really detailed online questionnaire that asked people directly about how they were coping.
And this wasn't just a simple, hey, how you feeling today kind of survey. Nope. The researchers used globally recognized, totally validated scientific tools, the PHQ-9 for depression and the GAD-7 for anxiety. They were screening for actual clinical symptoms. And that's what makes their findings so incredibly powerful. The data is solid. It's scientifically reliable.
Okay, so with their methods locked in, the team started crunching the numbers. And what they discovered was, to use their own word, alarming. So let's take a look at the big top-line results first.
Get this. An incredible 52.5% of the entire university community showed symptoms of anxiety. Just let that sink in for a minute. That's more than 1 out of every 2 people, students, faculty, staff, experiencing significant anxiety during that time. Wow.
And the numbers for depression, they were almost as staggering. 39.2% of everyone who took the survey met the criteria for symptoms of a major depressive episode. That's nearly 2 out of every 5 people in this community.
Now, those overall numbers are shocking enough on their own, but they're actually hiding an even more dramatic story. You have to wonder, right? Was everyone hit equally? The researchers dug a little deeper into the data, and the answer was a loud, clear no.
And here it is. This chart shows the core finding of the entire study. Just look at the difference in those bars. The one for undergraduate students is just soaring way above the one for university staff. This really shows that the pandemic was not an equal opportunity crisis. Not at all.
And let's put the hard numbers to that picture. Almost half, 49.1% of undergraduate students showed symptoms of depression. For staff, that number was down around 15%. That's more than a threefold difference. And for anxiety, you see 60.5% of students versus about 32% of staff. It wasn't just a gap, it was a chasm.
Okay, so we know that students were hit the hardest. The next obvious question is, why? What was it that made certain people so much more vulnerable? Well, the data actually reveals some pretty surprising risk factors. First off, it turns out the pandemic was a massive amplifier of existing struggles. The study found that people who already had a mental health diagnosis before 2020 were way more likely to experience severe symptoms during the lockdown.
And the effect was huge. For example, people with a previous diagnosis of anxiety had a 72% greater prevalence of depression during the pandemic compared to people without one. It's like the crisis just poured gasoline on an existing fire.
But the next risk factor is maybe the most surprising of all, because it points to this really painful paradox at the heart of how we responded to the pandemic. The study uncovered a link that's best summed up by this phrase: the very measure meant to keep us physically safe was also linked to higher distress. It sounds totally counterintuitive, right? But the data was crystal clear. The people who followed the strictest social isolation rules
actually reported worse mental health.
And the details here are just fascinating. The study found a direct correlation. The more often somebody went out, even for little things, the lower their rates of depression and anxiety were. This was especially true for students, where staying home all the time was directly tied to a higher chance of being depressed.
So what do we do with all this? What does it all mean? Well, these findings from this one university in Brazil back in 2020, they paint a picture of a really profound and complex psychological crisis. It's what you could call the pandemic's mental health echo.
All right, so let's pull it all together. The key takeaways are pretty clear. The mental health toll of the pandemic was enormous, and it absolutely did not affect everyone equally. University students were a particularly vulnerable group. And crucially, the study shows that while things like social distancing were vital for our physical health, they came with a serious and maybe unintended psychological cost that we really have to acknowledge. And that leaves us with one last big question that kind of hangs in the air. This study captured a very specific moment in time, the summer of 2020. The lockdowns are over, life is kind of back to a new normal. But for that generation of students who went through this, is that mental health echo still reverberating today? That's definitely something worth thinking about.